Welcome back to Medical Monday. We are talking about lung cancer today, cancer of the esophagus. If you have a call or you have a question, go ahead and give us a call. We'd be happy to answer it. When I say we, I mean he, Dr. Ninan. Thank you so much for being here. And we do have a couple of callers on the line, so let's get first to Shirley. Shirley, thank you for being with us. What's your question?
My daughter is still smoking e-cigarettes. She smoked regular cigarettes for a long time, but she was trying to quit, so she went to e-cigarettes. Is that going to help at all?
Great question. I know there have been many studies already done about this. What's the answer?
So it's, the issue is that if your daughter has smoked standard tobacco for years, then she does have a increased chance of getting lung cancer. So she has to have checkups with her doctors from time to time. So that's number one. The second is switching to e-cigarettes is good in the sense that you're not inhaling all that tar that is associated with tobacco. However, we still don't know what the long-term effects of vapors and all that are. Now, there is already some data that says that patients who smoke e-cigarettes can get an unusual lung condition called interstitial lung disease. In the press, it's been called quote-unquote popcorn lung, because it was initially seen in people who worked in the popcorn industry. They inhaled all that chemicals and got a unusual disease of the lung, which causes scarring inside the lung. And so they are seeing those kind of illnesses now in patients who use e-cigarettes. So we really don't know what the long-term effect is. The second issue that we have is that whether e-cigarettes actually causes people to quit tobacco smoking, and we don't know that. It could be that they use e-cigarettes for a while and go back because they're still used to, putting something in their mouth and inhaling it. So these are the issues with e-cigarettes. I think, the jury is still out on a lot of that.
Okay, but you would tell your patients what?
So I have told my patients that if you can, a lot of my patients who come to me with major illnesses are still smoking. And if you get a medical condition that requires you to go into hospital to have surgery for anything, abdominal problems, orthopedic problems, and you're still smoking, your incidence of having a bad outcome from surgery is higher if you're still smoking. So it is not necessary that you just go in and have lung surgery, for example. But even if you're having a hip replacement or a knee replacement or an abdominal surgery. So that's why it's very important to quit smoking as you get older, especially because your chances of going into hospital for some surgical procedure goes up as you age. And so you really don't want to put yourself in that high-risk category when you go into hospital. So that's why I advise all of them to quit smoking. Now, if somebody tells me I cannot quit tobacco and I just want to use e-cigarettes for a while to kind of get through this, I say that's okay. I try to treat them by using all the standard treatments that we have, but in those instances I permit them to use it with the idea that within a few weeks they're going to give that up also.
Okay, good answer. All right, let's talk to Cindy. Cindy's got a question for us. Go ahead.
Yeah, what causes esophageal cancer?
Okay, straightforward, good question.
Thank you, Cindy. So, esophageal cancer is a cancer that nowadays usually occurs in the lower part of the esophagus. And this is one of the few cancers that is actually increasing in the country. And for the last few years, that's for at least about a decade, this trend has been noted that people who get cancers of the lower end of the esophagus are generally not big-time smokers or drinkers. So the question was, what is it that is probably increasing this incidence? We know that our body mass index, or your height to weight ratio, is gradually going up in the population. And the incidence of heartburn, that is reflux, that is the acid from your stomach washing back up into your esophagus, that is also increasing. And so we believe it might be related to that. And so we really don't know what the cause is right now of the newer types of esophageal cancer that we are seeing, but it's certainly related in some way to reflux disease.
Now, if you watch the news or any show on TV, you see all kinds of drug ads for acid reflux issues all the time. So if you're taking one of these drugs, does that lower your cancer risk, or is it a wash?
That is a very good question, and sometimes you really don't know whether these drugs are lowering the incidence of esophageal cancer. Certainly as a population, we are not seeing that. You know, the population is using these drugs more and more off the counter, but the incidence of esophageal cancer continues to rise. So we really don't know that. However, if you have documented reflux, your gastroenterologist will treat you with acid lowering medications, and that is important for a variety of other reasons, not just for cancer alone. Now, whether in the long term lowering acid truly reduces the incidence of esophageal cancer, we have to see. But I would say that, you know, most of the studies are suggesting that treatment of reflux is very important.
Okay. Brian is on the line, waiting so patiently. Brian, what's your question tonight?
Oh, and so your lady associate producer told me to ask why I have heartburn when I'm 49 and I don't eat much barbecue. I don't smoke much, just, you know, at nighttime. And I've laid off the hot sauce. But as I get older, it seems like I get that heartburn. So I know it's pretty minor. I guess it's esophageal. My lady said I should never eat hot sauce anymore, drink more good water, and I don't know.
Oh, well, let's talk to the doctor. Brian, thanks for calling in. So what causes heartburn, and is it age-related?
Yes, it is. You know, the incidence of heartburn goes up as you age, and the valve at the lower end of your esophagus that prevents the acid in the stomach from coming back up gradually gets to be loose in patients like this. Now, this has traditionally been treated by using acid lowering agents, especially drugs that prevent this reflux from occurring. Nowadays they are available over the counter in multiple formats, etc. But we've been finding that these drugs themselves are not very innocent. They can cause problems if you take them in the long term, especially it's shown to produce kidney problems and things like that. So you know, it should not be taken in the long term without having your doctor actually see you for heartburn. The second issue is that we know that, you know, if you have very severe heartburn, which is barely being controlled by the medications that you're taking, then we need to think about surgical methods to reduce heartburn. And that has multiple effects, because people can get pneumonias from severe reflux. While you're sleeping at night, you can aspirate stuff into your lungs and get pneumonias. You can get other problems of the esophagus, like ulceration of the esophagus. You can get strictures of the esophagus, which is narrowing of the esophagus from acid. All those things you want to reduce by getting the correct treatment. So some patients may need surgery. And I should say a lot of the surgery today is done very minimally invasively. Many patients go home in a day or two. And those patients with very severe reflux that's not being controlled by medications or on long-term medications, they need to talk to their doctor about referral to a surgeon like ourselves.
Okay. Good information. We're going to take another quick break. Juanita, Tom, I know you're on the line, and many more. We're going to get to your calls right after this. Stay where you are.